He's going to present today about some interesting case in his practice. Thank you. But this lecture is recorded.
That could go well beyond the time that I have today. So I want to hit some highlights about communication with patients. And had many insights of my own over the years. I guess some I've been taught, but some of them are just so off the target. You just don't understand. So I'm going to show 6 challenging cases and 6 lessons learned. I just want to explain that cartoon. So Midvale, that's just the name of a school they made up. And this author is a very good, does some very funny pictures, but this one here is this school for the gifted. And you can see this gifted child, who's obviously brilliant, is pushing on a door that says pull. And that's the way it is sometimes. That's the kind of case I'm talking about. When you're dealing with a patient or a patient's family, and you're trying to think about how to get the message across, and you often feel like you're pushing on a pull door. Now, here's the first case. This one's very important to me because it talks about sisters. This actually is my sister. And the title of this is Credibility of Sisters. Credibility is not generalizable. What do I mean by that? Here's the clinical story. A woman was in my clinic, she's in her 30s, and she had adult onset acne. And so I said to her, here's what you have, and here's what we need to do. And she thanked me very much, and she asked questions, I answered them. And I said I wanted to see her in about a month or so because I like to make sure, once you've started somebody on something, are they going to still be using it? Are they not? Do they have a problem? Do they need to be redirected? So she came back a month later, and I asked her how it was working. And she said she didn't use it. So I said, oh, okay, why not? And she said, my sister thought it was a bad idea. The pause is on purpose, just so you can think about how many times you've heard that. So I said, it's interesting. I'll ask my sister what she thinks. And the patient said, is your sister a dermatologist? I said, no, she's an optometrist. And she looked at me with her eyes sort of squinting, going, well, what would she know? And then she stopped talking. That's why I have the ellipsis at the end there. She just stopped talking because it was so obvious that her sister and my sister have nothing to do with this. So the message in this one is how do we deal with that invisible advisor? You keep it fair. Keep it in the same level, a peer level. Advice should be kept on a peer level. Your sister versus my sister. You're having a scalp problem and your barber says this, then I'll talk to my barber and see what they think. I don't have to compete with their barber. No, my barber and your barber can get together. So that's the idea. And I think this will come up. You'll see, I'm sure in the next week even, you'll see this and you'll think, oh, I know what to do. So you can talk about my sister if you want. Here's lesson 2. Using pain for gain. That's what I call it. And there was a shampoo called Denerex shampoo. I don't know if it still exists. This goes way back, but it had an impact on my career. And in the commercial on television, they showed this woman, and in front of her is a little bottle that has Denerex shampoo on the left side. On the right side, it's some other shampoo. It doesn't show you the name. It's just some other shampoo. But why was the Denerex special? Well, because you can feel it tingling. And so they did the split scalp comparison of these 2 products. Now, one, you should never do that. I was involved in a clinical trial many years ago, very early phase, where they had half the body get one thing and half the body get another thing. And I was going to write a paper, the 20 reasons why that's the stupidest thing in the world to do. But the simplest example is if the patient gets anything, their blood pressure goes up. Which side of the body did that? I mean, it makes no sense. But people did that, and I don't think anyone does that anymore. But here, this is just a commercial on television. And in the commercial, on the side where the Denerex is, she says, it tingles. Well, wait a minute. That's a side effect. It tingles, and the announcer's voice comes over and very thoughtfully says, you can feel it working. And I remember I was watching this, I thought, oh my goodness, this changes my life. The power of a positive spin. Knowing that discomfort is part of the treatment can be very reassuring. I used this the very next day, honestly, for a patient with actinic keratosis, and he's in my office and I'm spraying these with liquid nitrogen, And he's saying, ow, ooh, that hurts, ouch, ooh. And I leaned over a bit and I said, you can feel it working. And he said, maybe you better give it a little more. So it's good to know that you can take something that's negative and don't fight that. Go with it, but make it a positive spin. Lesson 3, the cure trap. Now, there are many words that are used in medicine in many areas that really mean nothing. Cure is that kind of word. And you want to set shared goals. Now, the reason I got really interested in this was early on, when people would come in and say, oh, can you cure this? And I'd say, well, and I'd get into some bizarre philosophical discussion about what cure means. But when rubber really hit the road was when we were doing all these early studies in mycology and looking at nail infection. The Food and Drug Administration, or at least people in that organization, said, well, wait a minute, you're talking about getting cure. What if it comes back in 6 months? Then it wasn't a cure. So what does cure mean then? Cure means it goes away. It comes back, okay. But it became a problem. So it can be very frustrating. So now, when I see a patient, I'll say my goal is the same as your goal. I don't have to contradict their use of the word cure. I just say very simply, my goal is the same as your goal. I won't be happy unless you have 0 psoriasis, acne, dermatitis, whatever it is. We're on the same page. Tip 4, this one's longer. Be prepared. Do you have something natural? Another word that means nothing. The actual education here is about infophobia. I'm guessing, like the emoji shows, you think, what's infophobia? I've never heard of it. You probably never have. And despite our attempts to get it published, it wasn't until recently we finally got a journal that would. But here's what it's about. I have a patient who comes to see me. She has pemphigus, quite bad, very challenging, older woman. And when I say she's challenging, that's always the kind way of saying, I have a stomach ache when she's in the clinic. Severely infected lesion. Umbilicus is just dripping with pus. Otherwise, she's not doing that badly. And she needs treatment, but she always researches it. Her and her husband would research everything and come back and say, oh, we researched this and it causes this disease and that disease with every drug I gave her. But I do know she always wants something natural and she wants something with no side effects. Reminding myself that natural means nothing and no side effects also is ridiculous. You could choke on a glass of water and die. But that's what she wants. And what could I do? I don't know. I just looked at her and went, I used to say to patients, well, curare is natural and it can kill you. Didn't mean anything to anybody. So the sun is natural. Well, that came out. I had a woman who's a distant family member who grew up in Egypt, very fair, red hair, and was covered with actinic keratoses. And she wanted something natural to get rid of them. And I said, well, the sun is natural, and that's what caused your skin cancer. There's nothing to it. Nothing. That's really strange. So what can I do? Now, Dr. Heather Boone's a PhD who's done a lot of research in the area of people's perception of natural, and most of it is psychological in terms of my understanding, and I really don't understand all of it. But I did remember a presentation I heard of hers. And a study that she did that I believe was not published, and I checked with her, I don't think it was an opinion on a therapy that was called all natural. And they wanted to have people who were interested in natural therapies come in an evening. They divided it up into 2 groups that were quite similar, so they could have them, male, female, etc., on both sides, and to talk about this. So the 2 groups, there was a difference. They were shown a picture of a plant, like the one on the right. Both groups were told it was the basis of a treatment. And both were told it was something that was all natural, and it could help mood, depression, and sleep. So here's something that's all natural, reminding myself that means nothing. And then some nice things that it could do. But when they actually had a further discussion, if you will, in the group 1 was given the information that I would say I would get from my local health food store. It's all natural, there's no side effects, it's very effective for many issues, as they were told. Group 2 was given that, as well as some medical information, the kinds of things you would see in a product monograph, or perhaps even if your physician was kind enough to talk to you about it and say, oh, by the way, if this happens, let me know, and here's some things that could happen. And oh, it can interact with some medications. Let me see what medications you're on. This doesn't come up in the usual discussion. So what happened? Well, it ends up, the information they were getting was about St. John's wort, which is a natural therapy that's quite popular among people who do that. And they were really interested. That happy emoji, they loved it. This is great. Oh, it sounds great. This stuff does all this stuff, and it's all natural. I just love that. Group 2 were given all the same information, but they were also given some medically based information. It can cause insomnia, anxiety, dry mouth, dizziness, gastrointestinal symptoms, fatigue, headache, sexual dysfunction, drug interactions, and it goes on. But it is all natural. They didn't care. They wouldn't use it. I thought, wait a minute, that's amazing. Why do they keep saying they want something that's all natural and then they reject it when they get any information? Because they're infophobic. But before I get into that, I want to talk about St. John's wort. Here's an example of something I just got off the internet. Good news, right? Possible health benefits of St. John's wort. Okay, possible. Well, okay, so maybe it's not going to work for everybody. So is there not really a lot of news, but is it bad news? They don't say that. It boosts your immune system, if you will. It boosts your mood. It helps with premenstrual syndromes, smoking cessation, seasonal affective disorder. Good gracious, it's amazing. And underneath, in perhaps almost a recognition that maybe that's too glossy, they say, note, the benefits of St. John's wort are still being explored. Now, to me, that would mean they're looking into all the potential side effects it could cause. But no, all it means is, this is just 6 wonderful things. We're going to find hundreds of other fantastic things that it does and never mention any side effects. So I'm still dealing with this lady with the pemphigus, and I had to come up with something. So thinking back on all of this, I told her, and I remember I'm standing up in the clinic, and I said to her, I'm going to make something especially for you. And I left the room, and I went and I got a clear jar, and I put 3 different creams in the jar, 3 different white creams, just like the picture there. I came back with this clear jar. It had no information on it. It had nothing in it, just a white cream. And I didn't tell her anything else. I just said, here, this is what I want you to use. And I was just waiting for what kind of question she'd have to ask, and is it all natural, etc. But that isn't what happened. Here's exactly what she said. Professor, you are a genius. Wow. I don't hear that very often. I said, how often do I use it? That's her only question. I said, I want to use it 3 times a day. And I asked her what her daily schedule was like, and I gave her 3 specific times to use it. She was great. She left. So the jar contained 3 creams, a corticosteroid, an antifungal, and an antibacterial. And as to fill in the antibacterial role, we happened to have flamazine, silver sulfadiazine in clinic for wounds. And so I gave her some of that. I gave her that. And she came back 3 weeks later like we had planned. And she said the cream was fantastic, and she was using it as recommended 3 times per day. She'd used it all up, and she wanted more. Okay, so I had that empty jar there. I went back out and mixed up some cream. And then she came back 2 weeks later without an appointment, and my receptionist came back and said she's back. So why is she back? She said, you gave her the wrong cream. And I gave her the wrong cream. Well, as it happens, we had no silver sulfadiazine, so the only thing that was different was I used fusidic acid. And then it dawned on me. What she had noticed was that it turned gray. And it turned gray because silver oxidizes and turns gray. So wait a minute. The first cream turned gray, and the second cream stayed white. She loved the first cream, but said the second cream was wrong because it didn't turn gray. I would have thought somebody who truly was worried about adverse reactions or things like that would have said, you know what? That first thing turned gray. I was worried about that. I'm glad you gave me the second one because it didn't turn gray. But no. That wasn't the case. It takes me a long time to get into her mind, I'm telling you, and I'm obsessed. She was obsessed by safety concerns, but she certainly was not upset by natural information. Cream turning gray, not an issue. Cream staying white, that was a concern. She was infophobic. She couldn't handle information. She really didn't care if it was natural or not. She said that, but she didn't really care. She needed 0 information, or at least the glossy information from St. John's wort that just says, oh, it has all kinds of wonderful effects, and it can do even more. We're looking into it. Doesn't mention any of the side effects. Not knowing what was in the cream was the safety she was seeking. So I have to thank Sylvia Martinez Cabrales, who's working with me to be able to get this published in the Journal of Dermatological Treatment. We call it Time to Codify a Challenge in Communication. There are only 2 papers in the literature that even mentioned the term infophobia. And they were thoughtful, but none of them were relevant to our situation, nor were they as clear as this. This was clearly something that makes no sense whatsoever. And here's what we walked into. Okay, now a few things to close with, lesson 5 and lesson 6. Lesson 5, suggesting biological therapy. Sometimes we run into that with biological therapies and maybe targeted therapies as well. It would be the same thing if it was a JAK inhibitor. Patient comes in and knows they need something, and in fact, they've probably been told they're going to see Dr. Shaer because you're going to get this biologic drug or JAK inhibitors, and I'm worried that it will lower my immune system. Well, that's sort of the idea. It'll wreck my immunity, whatever that means. And sometimes even the illogical, do you have something to boost my immune system when you've got an autoimmune disease? So how do you deal with that? So it was in the spring, a couple of years ago, and the snow, ice are gone, trees still haven't got leaves on them. And my wife asked me, can you just snip off that way up at the top? There's a branch, one little branch that's near an electrical thing. I'd like to get that cut off. So I do have this big clipper thing, and I went up and I'm starting to trim it off. And as I'm trimming it off, I realize, oh my goodness, this is so important. That one little branch. Everything is in that one little branch. So now when a patient says to me, it's going to wreck my immune system or I'm worried about it, I stand up because they don't know anything about the immune system. Seriously, and why should they? I stand up just to get their attention because I'm becoming a tree. And I say, I'm a tree, and I lift my arms in the air and I wave my fingers around. I open them up, and then I fold down one finger, one little finger, and maybe 2 if I know that it's going to affect 2 targets. And I say, the immune system is like a tree. All of these branches are doing something. But the little ones at the top are sometimes doing something bad. And if we just snip that one off, you're going to be fine. And I have to say, patients really buy into it. And in fact, I was giving a talk, and an allergist in our province said, I'm going to steal that because I have a lot of trouble getting people to understand what's going on with the immune system. The immune system is like a tree, and we're only taking off one tiny branch. Lesson 6, I tried everything, nothing works. I'll try to use it like we discussed. So here's what I do. Patients come in, I gave them stuff. They say, well, you know, Dr. Shaer, I have to admit, I didn't use it. And I say, why not? I say, well, I don't know. You know, I was a bit hesitant. But I said, well, do you think you can use it? Yeah, I'll try. I'll try to do it. And I look at them and I say, try to stand up. And they look back at you and they go, I'm sorry? I said, try to stand up. They look back again. What? I said, try to stand up. No one has ever stood up when I've asked them to try to stand up. There is no try. Do or do not. There is no try. Yoda's got it exactly. And we can learn from that. There is no try. And once they know there is no try and it's another fake, it really helps. So let's make a shared plan. It's really nice to sit down, and there's many ways to do that. I have a triangle, I have all kinds of things I do to say, here's what we're going to do, and you're going to actually do it. And I'm going to see you in this many weeks to make sure you're doing it. Personalized advice is always appreciated. And I'll end there. Thank you very much, and take care.